think I thought that we would get together with some designers, we'd explain the problem to them, and that they would go away and design a solution, and that would be that.
We did take it back down to basics. What were we trying to achieve? And of course the designers were then able to start to introduce concepts, forms, shape, how these things could work.
It brought a different way of analysing a clinical problem. Right? It's a different way of thinking about solving healthcare problems on the ground.
I was always interested in exploring how healthcare staff perceive these pathogens that cause the healthcare associated infections. The designers and visualisers went and created the related dynamic visualisations, and we've now gone on to, with further funding from the HRC, to try and test these visualisations in an educational format.
In motor neuron disease, patients can experience muscle weakness. One of the users had suggested that she could lose upward and down movement if she could effortlessly turn her head. And it was mocked up as something for the users to try. You know, I remember thinking we could develop this.
There has been work done in the past on measuring the centre of gravity. Before, it's never been done as a joined up way, and that's what this project was about. Along the way, we've come up with a whole list of new concepts of where the product could go next.
One of the lessons that we would learn is that of piloting any sort of new or innovative approach that you might want to use, and then reflect on it as a team on the value, eliciting from the participants themselves what they thought of it.
Once the clinicians realised that it was perhaps influencing their practice in a positive way, and that they could directly improve the tools that they had, it was very empowering for them.
I don't think we'd have ended up with the projects how it came out in the end, unless we had designers there with their input.